With me live right now is Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Of course, Dr. Joe joined us yesterday with an update on Damar Hamlin, the injured defensive back for the Buffalo Bills that happened on Monday Night Football. What about the last 24 hours medically? What do we know? And Joe, kind of why don't you take it from there and what you've learned on Damar Hamlin?
Well, Ray, as time has gone on, again, we're kind of looking in from the outside like everybody else. We don't have any inside information or anything like that. But as looking at it from the outside in the last 24 hours, we've been able to really kind of get a look at first of all, I think 3 points that I'd make. First of all, the incredible work by the medical team. It really turns out that it was life-saving. And although some of the other techniques that we use were not working to turn around his medical problems, the work that they did on the field was really life-saving. What's described as 9 minutes of CPR, the attempts at the shock treatment with the AED, they did everything in just an incredible job. They were so prepared, and it's really heartening to those of us that are a medical team, as we said a little bit yesterday, is a lot of times you're there for routine problems and musculoskeletal issues that come up, but you also have to be prepared for life-threatening issues, and they just really stepped up, and they did a great job. Now the real issue will be, as they worked so hard to try to get the blood flow and circulation back, were they able to save some of the organs like the brain and the kidneys? And I think that's what a lot of people are waiting to see in the next couple of days. So that's number one, just a real incredible shout-out as people have looked at how prepared the medical team was and what a great job they did and stepped up. Number two, it really appears that this is a very rare and complex cardiac issue that Damar Hamlin had on the field. And he didn't respond to a lot of the techniques, Ray, that we initially use on the field. And we're not sure exactly why. And that's a little bit concerning. It's unsettling. It's frightening for those of us that do sideline medicine. I know I've heard from a lot of our athletic trainers that I've worked with through the years, the certified athletic trainers that work so hard to be ready for these life-threatening situations, the EMS teams, the team physicians that are there. For whatever reason, in this very complex case that this young man had of cardiac issue, did not respond typically as to what we know through years and years of study and research and things like that as to what's the best way to approach this. And so that's unsettling to us, is that this is rare, and we'll be waiting even in the next few days as more information comes out about why that is. And the third thing has been, there has been kind of a positive part of the outpouring of love, of camaraderie between players and teams and athletes and people from other sports and other walks of life. The prayers from all these people that stepped forward, and that's the part, is that we can come together, and that this issue has really brought the nation together to some extent, I would say, has been very heartening to those of us that are in the sports medicine field. So those are three of the issues, the take-home points of some of the things in the last 24 hours, and obviously we don't have the answers to all the questions, and those will probably come in the days to come.
Joe, we hear that he's breathing today with the work with a ventilator to make it easier on the lungs. Is that good, bad, or indifferent at this point?
It's really, again, it's hard to know, but obviously ideally would be if he continues to progress and gets to the point where he wouldn't need the support of the ventilator and would be able to breathe without the need of the ventilator. I'm told also, that he has a lot of life support that he's still using to try to do everything we can to support those other organ systems, like we said, the heart, but also the brain, the kidneys, the intestines, so many other areas like that. really hoping to hear more information today that he continues to turn around and get stronger and that he's able to ventilate more on his own. So we'll be listening to hear that. But it's great to be that we have that kind of support in our intensive care units. And I also made a shout out to the people on the field, but also from what I've heard, the people at the University of Cincinnati, such a great medical center to be at, and what great work they're doing in the critical care and units there as well. I also want to just make a real shout out to them as well.
Joe, as always, my friend, thanks for the time and the updates, and we'll stay in contact with you. Thanks, Joe.
Okay, sounds good, Ray. Have a good rest of the week.
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, giving us an update on what he's learned in the last 24 hours pertaining to the tragedy involving Buffalo Bills safety Damar Hamlin.